Greetings. We're going to have a quick discussion here on manual interface, or what we're going to refer to as hands-on distraction without flexion. We put on our Versa belt in the standing position so that we have full access to the lumbar skin, lumbar spine. When we utilize this procedure, we're going to attach the hook at the bottom of the table. It's attached to the base pin in the bottom of the table. That will hold the lower belt down so that there'll be no issues of pressure or discomfort on the patient. It will also give us more of an axial pull. So we've attached the rope, the belt is being held down by the hook at the center of the table. One of the reasons we're going to do that is because unlike typical prone procedures, the table is going to be brought down to a height that's convenient for the doctor and the doctor's height. In this particular case, I'll go to about this level. And now what we do is when we begin the pull from the motor, allows us to utilize a standard hands-on contact at any vertebral level that we so choose. And we can offset with an inferior to superior pressure gradient in this way, allowing the motor to pull the patient downward. We can also utilize, because we don't have to operate the base of the table, we can utilize dual thumb positions and allow the pressure of our hands and our thumb to be mediated side to side, oscillated, or any other type of manual interface with the patient's body while the distraction is occurring. We can set the distraction at 4 or 5 seconds or as much as 10 to 20 seconds at a time, depending upon what we're trying to accomplish. One other aspect of treatment that we can utilize by the application of a traction force at the lumbar region, at the pelvic crest, is we can free our hands up to do cervical distractive procedures as well. So we can set the motor to pull at the lumbar spine. We unlock the table and we allow the distraction to take place. We can utilize traditional contacts in the cervical spine or the upper thoracic region, either the thenar region of our hand at that region of the cervical spine, or double thumb contacts, whatever is necessary to offset and put some inferior to superior pressure and downward extension on the cervical spine while the distraction is taking place. This is very similar to flexion distraction, but we don't operate the lower portion of the table and we don't have to impart flexion to the body. It's a distractive force elongating the spine. Our hands can be placed at segmental regions in the cervical spine to displace and to create distraction at those segmental regions.